Hi, I'm Gretchen Walsh, Doctor of Physical Therapy and Director of Clinical Excellence at Alliance Physical Therapy Partners. Joining me today is Dan Hirai. Dan is also a Doctor of Physical Therapy and Clinic Director at Soul Physical Therapy, our outpatient partner group in the San Francisco Bay Area. Dan has also been instrumental in doing telehealth and seeing patients all across California via telehealth. So that's been a really great addition to Soul and to Dan's repertoire. So Dan and I are coming to you today as part of the PT Insider series. And today we're going to be talking about knee pain. So Dan, I know that you really specialize in knees, you see a lot of knees. So, how often are you seeing patients that have knee pain, both in clinic and telehealth?
Thank you for having me. I appreciate it. Yes, definitely about 25% of adults have knee pain that is limiting to them in some way, shape, or form. And so of all the patients I see, knees right now are probably the most prevalent. I see them all the time, both telehealth and in person. And they're probably the number one joint that I'm seeing and treating right now.
Okay. And, there's obviously multiple reasons, people come in for, different things, related to knee pain. What are, 3 big ones that you would say you see patients for knee pain?
For me, the number one thing is just pain, whether it be more chronic or more of acute injury, like a younger sports-based injury or something like that. I also see sometimes just instability or weakness where people just functionally can't do what they want to do. They can't hike, they can't go up and down the stairs because they just don't feel, they feel like it's going to buckle, or they just don't feel like it's supportive enough. And then also I see, like I mentioned, with some chronic issues, sometimes just that stiffness, that achiness, that just, oh, it hurts after I've been sitting for a while and try to get up, things like that.
Okay. And, what are things that you're doing in the clinic or via telehealth? What are you doing to really, as a physical therapist, help with that knee pain?
Absolutely. So for me, one of the reasons I really like knees is because if you just change movement patterns, a lot of times you can have that almost immediate feedback. It's someone's going up the stairs, and all you do is you just say, hey, try this little bit of a movement here to kick on your butt a little bit, kick on your hips, and all of a sudden knee pain goes away. Or, the way that someone gets up and down a chair. So I always look at functional movement patterns and just the way they're moving, the way they squat, the way they do things like that. And we always look above and below the joint. Maybe we can change their shoes a little bit, and that makes a big difference. And so above and below makes a big difference. And then just strength. A lot of times it's weakness in the core, weakness in the glutes, whatever it may be. So the more we focus on just getting them stronger, that tends to help quite a bit as well.
Yeah, you make a great point. I know with my patients, I like to joke around and say, oh, you've got DBS, dumb butt syndrome. We just need those buns kicking in, get them stronger. But it really does make a big difference in helping to support the knee and below. So, well, great.
Absolutely.
Thanks, Dan. We want to keep this short and sweet. So I really appreciate your time. And, listeners, we hope you found this helpful. And look for our next episode of the PT Insider series. In the meantime, please follow us on Instagram and Facebook at Alliance PTP. Thanks again, Dan.
Thank you.